There are 5 medical tests you should avoid after age 70 because they could do more harm than good. There's a hidden truth that most seniors never discover from their doctors. Every year, millions of seniors go for health checkups, believing they're protecting their health. But what if I revealed that some of those routine tests your doctor says are necessary could actually be putting you one step closer to surgery, strokes, or even cancer? New research shows that up to 37% of medical exams in older adults lead to unnecessary treatments, complications, or permanent consequences. And surprisingly, 99% of people over 70 are completely unaware that they are being overscreened. One of these tests, the one that tops our list, is responsible for 5% of all cancer cases in the United States, equivalent to the number of cases caused by daily alcohol consumption. You won't receive this information from your healthcare provider. You won't see it advertised on any poster, but the truth lies buried in scientific research. And today, we're bringing it to light. In this post, we'll cover the 5 health checks to avoid after age 70 and the disturbing truth about what they can do to your body. It's all backed by real scientific evidence, and you won't believe what made it to number 2. Before we begin, let us know in the comments where you're watching from, your age, and if you've ever regretted a test or procedure. Do you think seniors are subjected to too many tests? We're reading and responding to every single comment with personalized tips and advice. But before continuing, please like the video, share it with people who might benefit from it, and let us know in the comments which city you follow our YouTube channel from. Now, without further ado, let's talk about the first test. It seems harmless, but it could silently ruin your quality of life. Number 5, bone density testing. It seems harmless. A quick scan, no pain, no needles, and you walk away knowing if your bones are at risk of fracture. But here's what no one tells you. Over the age of 70, a bone density test can often generate more fear than benefit. This scan, officially called a DEXA scan, evaluates the strength of your bones. It's primarily used to identify osteoporosis. But in older adults, especially women, the results almost always show reduced density, even when there's no real risk. This is because bone loss is a natural part of aging. Just like wrinkles or gray hair, it happens to everyone. Yet, many older adults are pressured into taking medications like bisphosphonates, which are supposed to strengthen bones but come with serious side effects like osteonecrosis of the jaw, a rare condition where the jawbone begins to die, and esophageal irritation. Now, here's the problem. Studies have shown that treating mild bone loss in people over 70 with drugs has little or no impact on actual fracture rates. A study published in the Journal of the American Geriatric Society followed over 1,200 women over 70 and found that bisphosphonates reduced fracture risk by only 0.3% after 5 years. It's nothing, but it's far from life-saving. Instead, those women were much more likely to suffer from drug side effects, including digestive problems, esophageal inflammation, and brittle bones that break in strange ways. Let me tell you about Rosa, a 76-year-old retired piano teacher who was sent for a DEXA scan after her annual checkup. She had never fallen, had no pain, and was walking daily. Her scan came back showing osteopenia, which is a mild reduction in bone density that is not considered osteoporosis. Her doctor immediately started her on alendronate, a bisphosphonate. 3 months later, she developed severe reflux and jaw pain. When we saw her, she hadn't played the piano for weeks. We took her off her medications and started her on a vitamin D regimen, weight-bearing exercises such as resistance bands, and a calcium-rich diet with foods like sardines and green leafy vegetables. A year later, she was back performing with stronger legs, better balance, and no fractures. A bone scan may seem like a smart move, but for people over 70 who don't fall or break bones, the best option is lifestyle. Strength training, balance exercises, proper nutrition, and treatment of vitamin D deficiency have been shown to reduce fractures by more than 20%, according to a 2022 Osteoporosis International study. Don't let a number on a screen scare you into a treatment you might not need, but there's a scan that can lead to something even scarier: brain surgery. Let's talk about it now. Number 4, brain MRI for memory loss. When older adults feel more forgetful or confused, the natural impulse is fear. Fear of dementia, fear of Alzheimer's. So doctors often respond by ordering a brain MRI. But here's the inconvenient truth. MRIs, which are detailed scans that show brain structure, rarely provide the answers patients hope for. In fact, most MRIs in people over 70 simply show age-related changes, such as mild shrinkage or patches of white matter that are completely normal in older adults. But here's the twist. Once those spots are seen, they can trigger a cascade of fear, further tests, and even surgery. Surgery that may not improve memory and may actually make things worse. In 2021, a study published in Neurology Today examined over 3,000 MRI scans of patients between the ages of 70 and 85 with mild cognitive impairment. 86% showed some form of brain abnormality, but only 3% of those results were linked to an actual treatable condition. This means that 97% of people have experienced the emotional trauma of feeling something's wrong when in reality there isn't. Worse still, nearly 12% were referred for invasive procedures like lumbar punctures or even exploratory biopsies, all based on vague scan results. Consider Giorgio, a 74-year-old retired engineer who arrived worried about forgetfulness. He was brilliant, but he misplaced his keys more often and occasionally forgot names. His doctor sent him for an MRI, which showed changes in his white matter. He panicked, convinced he had dementia. He stopped driving and stopped going to church. Over the next few months, his anxiety worsened. But when we reassessed him using a standard cognitive test, his score was well within the normal range. We explained to him that the MRI results were appropriate for his age. We helped him focus on lifestyle interventions like sleep, hydration, and brain games. Within 3 months, his memory had stabilized and he felt like himself again. The truth is that unless there are severe neurological symptoms such as seizures, sudden personality changes, or rapid functional decline, an MRI is rarely helpful for mild memory loss. A better first step is a cognitive screening test, which is a simple paper-based exam that assesses memory, attention, and problem-solving. It's inexpensive, effective, and avoids the risk of unnecessary panic. Now, brace yourself, because the next test on this list is one you've probably done several times, and it's number 3 for a reason. Number 3, cardiac stress test. It's one of the most common tests given to older adults who complain of mild fatigue, chest tightness, or simply not feeling like they used to. Cardiac stress testing, a procedure that monitors your heart while you walk on a treadmill or receive medications that simulate exercise, is designed to detect blocked arteries. But after age 70, this test often does more harm than good, especially when used on people who have no clear signs of heart disease. This is because it can lead to false alarms and unnecessary cardiac procedures that carry serious risks. The problem lies in accuracy. Studies show that in adults over 70, the false positive rate for stress tests, meaning the test indicates a problem when there isn't, can be as high as 40%. This leads to follow-up tests such as angiograms and even unnecessary stent placement or bypass surgery. In 2017, a major study in JAMA Cardiology found that more than half of all stents placed after referrals for stress testing were done in patients who had no real symptoms or benefit. And those patients had no improvement in survival or quality of life after the procedure. What they did have, however, were higher rates of bleeding, kidney damage from contrast dyes, and prolonged hospital stays. This happened to Raimondo, a 75-year-old retired postman who remained active by walking every day. During a checkup, he mentioned that he sometimes felt tired on hills. His doctor scheduled a stress test just to be sure. The results were unclear, so he was sent for a catheterization, a test that inserts a tube into the arteries to check for blockages. A mild narrowing was found and a stent was placed. But that night, Raimondo had a reaction to the contrast dye and developed kidney problems. He spent 6 days in the hospital and required follow-up care for weeks. The fatigue never improved because it wasn't a heart problem from the start. He was simply an elderly man who needed better hydration and more rest between meals. If you're over 70 and aren't experiencing classic cardiac symptoms like chest pain during activity, shortness of breath on exertion, or a significant drop in energy during light exercise, then an exercise stress test may do more harm than good. A better option is often a resting electrocardiogram, which is a test that observes your heart rhythm while you're still, or even a coronary artery calcium scan, which is a low-radiation imaging test that shows if dangerous plaque is building up. These are safer, simpler, and much less likely to push you into an unnecessary procedure. Number 2, colonoscopy. You probably didn't expect this, but colonoscopy, a procedure that uses a long camera to examine your colon, isn't always a wise choice after age 70 and is almost never recommended after age 75 unless you have specific symptoms. Risks increase with age. Preparation is demanding, involving strong laxatives that can cause dehydration, dizziness, or kidney problems. The sedation used during the procedure poses additional risks to brain function in older adults. And perhaps more surprisingly, the test itself can cause complications such as bleeding, laceration, or even cardiac arrhythmias during sedation. A 2019 study in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and over. They found that for every 1,000 colonoscopies performed on patients over 75, only 2 lives were saved, but over 20 people experienced serious complications. That's a risk-benefit ratio of 10 to 1, and even when polyps are found, many are small and slow-growing. Removing them in an older adult can sometimes do more harm than leaving them alone. Dana was a 73-year-old grandmother who ran a small bakery with her daughter. She had no symptoms, no bleeding, no changes in her stool, and no family history of colon cancer. But her new primary care physician, fresh out of residency, urged her to have a screening colonoscopy. She agreed. During the procedure, a small polyp was removed and she was sent home. That night, she experienced severe abdominal pain and fainted. At the hospital, they discovered a perforated intestine. She spent 9 days recovering, lost 10 pounds, and hasn't been the same since. When we reviewed her case, we discovered she'd already had 2 clean colonoscopies in the past. There was no reason to repeat it. The U.S. Preventive Services Task Force currently recommends stopping routine colon cancer screening at age 75 for most people. For those in excellent health, a stool-based test like the FIT test, a non-invasive at-home fecal test, is often a safer option. It requires no preparation, no sedation, and still catches the majority of worrisome cases. Ask your doctor about alternatives, because once you're on the colonoscopy journey, it's hard to get out. And now we've reached the most abused, dangerous, and harmful screening for seniors, and you've almost certainly had it done. Number 1, annual full-body CT scans. Full-body CT scans, which are sometimes offered as part of executive healthcare packages or as preventative services in private clinics, are marketed as a way to catch cancer early. But here's the shocking truth. These scans expose your body to a high dose of ionizing radiation. For older adults, especially over 70, the risk of triggering unnecessary follow-ups, biopsies, and even surgery is incredibly high. And the irony is that there's zero evidence that symptom-free whole-body scans save lives. Each scan delivers between 10 and 20 millisieverts of radiation, equivalent to about 500 chest X-rays. According to a 2023 modeling study published in JAMA Internal Medicine, the increase in CT scans in the United States may now be responsible for up to 5% of all cancers, putting them on par with alcohol as a carcinogen. This means that 1 in 20 cancers could be caused by a scan that was supposed to prevent disease. It's not just counterproductive, it's terrifying. The scan can detect harmless nodules, calcifications, or cysts that are simply part of aging. But the moment they're seen, a red flag goes up. More scans follow, then biopsies, then panic. Let me tell you about Marco, an active 80-year-old who taught martial arts to younger seniors. He felt great and attended an elite senior checkup at a private clinic. His full-body scan revealed a tiny 3-millimeter nodule that set off a chain reaction. He was referred to oncology, sent for a PET scan, and eventually underwent a needle biopsy. The results were benign, but the biopsy collapsed part of his lung, leading to hospitalization and a 2-month recovery, all for something that could have been left untreated. Experts now advise that whole-body CT scans should never be used for general screening in asymptomatic adults. The American College of Radiology is clear. There's no proven benefit and significant potential for harm. If you have symptoms like unexplained weight loss, coughing up blood, or visible swelling, then targeted imaging makes sense. But scanning your entire body without focusing is like searching for treasure with a landmine detector. You might find something, but the damage could be worse than what you were trying to avoid. A safer and smarter approach is to listen to your body. If you feel well, maintain regular checkups with your primary care physician and only take tests that are clearly indicated. Your time, energy, and health are too precious to be wasted on fear-driven screenings that could leave you worse off than you started. So, there you have it. 5 tests that may seem helpful but can actually hurt, especially once you're in your 70s. Modern medicine is powerful, but it's not perfect. Sometimes less is more. Always ask, what happens next? What if this test finds something? If the answer isn't clear, or if the risks outweigh the rewards, it might be time to take a break. And remember, true prevention begins with lifestyle. Stay active, eat well, sleep soundly, and choose your tests wisely. Now, we want to hear from you. Have you or someone you love ever experienced complications from a medical test or treatment that turned out to be unnecessary? What happened? Share your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.